I came, I saw, I conquer it all. Yamina kasa washa meba. What's it then? What's it mamumbo? Bingana minya no more. Ziwa chinchina mama birakwa. Abine wasa mama musi me ya hunja mama kira. Ebe, onyana duma. Akweshana brain in he made me the winner. The head know that say now goodness and mercy they follow me.
That's right, goodness and mercy, they will always follow you, especially when you're tuned to Joy 99.7 FM, Ultimate Health. And we've got our guests from the Health Facilities Regulatory Agency, HEFRA, in the person of the Acting Registrar, Matthew Treme, and then also the Head of Operations, Dr. Erasmus Kluche, is with us here in the studio, and also have in the studio the Head of Licensing, Christabel Nuhoho, right here with me. So I've got a full SWAT team, but last week we focused on their functions under Law Act 829 of 2011. We got to learn of their legal mandates. We also learned that, relatively... shall I say, a small number of our health facilities are in good standing or have duly been registered and licensed by this facility. Today we want to look at what exactly they go through by way of registration and licensing, and what the real situation is, especially and particularly with unlicensed facilities. If you have any questions, concerns, you can address us to us by WhatsApp on 0244 340 437. So today we're talking about the regulation of health facilities in Ghana, our beloved country, which is almost 62 years old. Gentlemen and Madam, you're most welcome.
Thank you very much.
Right. And Registrar Treme, you were with us last week.
Yes, I was.
And we did some due diligence, and we felt it necessary to come back and help your organization or your agency communicate its mandate to the public. And I'm glad and grateful that I've got your Head of Operations, Dr. Kluche. You're most welcome.
Thank you.
And Christabel is also here. Right. So, Registrar, we went through the motions, and we didn't get too deep into operations. How you seek to, should I say, register and license facilities. If we can go back to that, you have the mandate to actually receive applications for registration, vet these applications, and then go through the processes which would lead to registration and licensing of health facilities. I think we did a good job of defining the scope of your jurisdiction. But if you can maybe recap on some of these things.
Well, anyway, thank you very much for having us again this Sunday. I'm always grateful that we have the opportunity to talk about these things of national importance and importance to everybody. So any opportunity for us to sell the agency and what we do, and to explain to people how they would understand what we do and how they should collaborate with us to be able to deal with something that is of interest to all of us, is always a welcome opportunity. So once again, thank you very much for having us. Yes, you have rightly said what we do as an agency. We basically license health facilities, okay? Now, to be able to license a health facility, we need to make sure that we register that facility, get all the paperwork in place, and make sure that the personnel that work there are squeaky clean, and they are qualified, and they are competent, and they are in good time with their professional bodies. We make sure that the equipment that they need to use are in place, and that they will be able to provide the service that they say they're going to provide. And obviously, we also spoke about infrastructure. I'm happy today that we have the Head of Operations who would be able, at some point, when you give him the opportunity, tell us about the details of what happens with this. But then let me also say that the mandate that for us to license facilities is a mandate that is given so that we ensure that we have the basic minimum requirements and personnel and equipment, so that we can assure people that when they go into a health facility, they have the confidence that they're going to a safe place, and a place that has got the basic minimum requirements as we expect it to be.
Okay, right. So if I may come to you, Head of Operations, Dr. Kluche. I understand you're a public health practitioner or consultant.
Consultant, yes.
Okay,
Exactly
but
correct.
you've been at HEFRA for quite a while as head of operations.
Yes.
Okay, so I have the right man in the right seat on the right station. Right. So let's clarify a few things. Your mandate says you register and you license. Okay. For my listeners, can we distinguish between registration and licensing?
Yeah, thank you very much. Thank you, listeners. The core mandate of HEFRA, as stated, is registration, inspection, licensing, and monitoring and supervision.
Right.
Those are the 4 core mandates of HEFRA. And the difference between registration and licensing is that licensing starts with the intent to set up a health facility.
Okay.
If you are a client, you want to set up a health facility, you give us a letter of intent indicating that you want to set up the facility. Then when you come to our office, we give you the general and specific requirements which you have to go through. Then you can go to our website, download application form.
Okay.
You fill the application form well, you submit the various attachments to the application form.
Okay.
When everything is set, then you've licensed with HEFRA. So
Okay.
from there, we take it to inspection.
You get your license before inspection?
No, that's the registration.
Registration.
The registration.
Registration means that you've submitted an application.
Yes.
It's been vetted.
It's been vetted, it's been considered, it's been approved.
All right.
Then registration has ended.
Okay. So what is the approval for? For your intent?
Yeah, the approval is that we've gone through the various documents you have submitted to us,
Mm-hmm.
and we've seen that all the documents are relevant,
Okay.
are correct. Then from there, we move on to inspection of the facility.
So when a facility is registered in this manner you've just described or narrated to us, it is not ready and it is not legally able or permitted to operate.
No, not at all.
So registration is not a certificate or an indication of your capacity or your, should I say, ability to commence
No.
operations.
Yes.
Okay. How would that apply to an already existing facility?
Yes, an already existing facility, we know they're already working. So definitely we encourage them to pick an application form, go through the process. By law, they're not licensed.
Mm-hmm.
By the law mandating HEFRA, if you're an existing facility, you are not licensed.
Okay.
But definitely we give them the opportunity to come to HEFRA, to go through the various processes and get their license and operate legally.
So by law, such a facility that already exists and is operating, let me say emphatically, in default of the law, what is their status? You are encouraging them, and I can understand the need for dialogue, but what is their status? And do they go through all the processes, or are they exempt from some processes?
Yeah, they're not exempted from any process.
Okay.
They have to go through the process, the legal process of registration.
Mm-hmm.
They have to pick an application form, submit all the relevant documents to us. They have to go through inspection. Then when we see that everything is okay, then we give them the license.
Okay.
Before they are legally allowed to practice as a health facility.
Okay. So if yes,
Can I just explain that for already existing facilities, as I said last week, there was what we call the Private Hospitals and Maternity Homes Act,
Yeah.
Act number 9, that gave licenses to facilities. I mean, as the name implies, they were private facilities. Now, the public facilities, like the Ghana Health Service facilities, were being managed by Ministry of Health and Ghana Health Service. So these obviously have a kind of a permission authority to be able to operate. Now, what we're talking now is talking about licensing your facility in accordance with the Act 829, because Act 829 brought some differences. In the first place, they made both public and private come under the same agency with respect to licensing, and also there were other things that were not asked for before, which are now asked for.
Right.
And the law said that when this Act 829 came into force, if you were registered under the previous Act 9, you would have, on the expiration of your license, you would have to come to HEFRA to get a HEFRA license.
Right.
So these existing facilities, yes, as Dr. Kuji rightly said, are not licensed in accordance with Act 829.
Does that not sound like a blanket assumption that if you are not licensed with us, we are assuming that you are licensed under the existing law? Should you not be able to or be required to prove that?
Well, we are not assuming anything. I mean, I was just trying to explain the point that
I understand the transition between the two legal documents.
Yeah.
Okay, and there are transitional provisions in the Act 829. Well understood. But what I'm saying is that we have a high number of defaulting facilities, even if we take what we know to be the number to be factual, right? Even on a presumed or estimated or projected number, there's a high default rate. And what I'm trying to get across to my listeners is, we know there are lots of clinics and health facilities, right, by anybody's definition.
Yeah.
Those that are not licensed, right, currently, and I know you'll be able to shortly give me a number of those that have currently provisional licenses under 829 and those that have full licenses under 829.
Yeah.
But the defaulting institutions, and this explanation you just given, are we assuming that, well, maybe they have a license, it's yet to expire, or what does it really serve?
Well, I mean, the point I was making was that you said you have a high number of defaulting facilities.
Do you disagree?
I can't agree or disagree. What I know is that with respect to Act 829, a lot of them are not in accordance with the Act.
And that's the
but that does not mean, for example, we talk about pharmaceutical facilities.
Mm-hmm.
Right, the numbers go between 9,000 and 14,000, including pharmacies and over-the-counter medicine sellers shops.
Yep.
Now, would you say they are all defaulting? I
am not the agency.
They are with respect to HEFRA, with respect to Act 829, they are not with us. But as I explained last week, Pharmacy Council tells us that they are regulating them.
When you say Pharmacy Council tells you, have they provided you with documentation that says so, or they just tell you? If I wanted to, I know we don't have right to information, but if I wanted to verify, of the 9,000 or so pharmacies you refer to, how many of them, even under the earlier provision, right, are in good standing? Are we able to tell that as we sit now?
I wouldn't be able to tell that. That's what I'm saying. Until they come to HEFRA for us to vet and verify what Pharmacy Council tells us.
Then
because, I mean, if you remember, I said at the last Sunday that the Act made provision for 5 years, within which Pharmacy Council would have transferred to my agency personnel,
irrespective of the
knowledge.
transfer.
Sorry. So that information and knowledge would have given me whether they are in good standing or not in good standing. I can only assume that they are until they have transferred to me.
Okay, let me correct or redirect my question for the benefit of my listeners.
All right.
Irrespective of the earlier legislation,
Yeah.
which held their regulation under the Pharmacy Council. Now, in 2011, right, 8 good years ago, we have enacted a new legislation which brings them under your legislation and gives you a leeway of 5 years to transfer that regulatory function to you as HEFRA.
Yeah.
All right, that's the transfer.
Yes.
It doesn't say that in that period nobody should know whether they are in good standing or not. And I believe that as collaborating agencies, HEFRA and the Pharmacy Council should be able to tell me that we have this number of pharmacies, albeit documented under our books, in good standing. But when you tell me you are unable to say so, then I am worried.
Well, don't be worried. I mean, maybe one day you should bring the Registrar of Pharmacy Council here to tell you, whilst they have not transferred these facilities to us, would they be able to give you information of those who are in good standing or not? But I will not be able to sit here and say they are not in good standing because I don't have that information.
But you should.
And
know.
I will also not be able to say they are in good standing or they are not in good standing because I don't have that information. I'm supposed to know if what we are supposed to have done has been done. Okay. That is, if the 5 years has been respected for all the information to be transferred to her, then I'll be responsible for responding to each and every pharmaceutical facility in the country. As it is now, I don't have that information. I will not be able to say either yes or no.
Right, great. 23 minutes past the hour of 2 on Joy 99.7 FM. We are having a dialogue with the Health Facilities Regulatory Agency. And you just heard speaking the acting registrar, Matthew Yao Treme. He was with us last week. And next to him, I have Dr. Erasmus Kluche. He's the head of operations. And we're seeking to find out really what the workings of the agency is, or the mode of work is, and then get a sense of the current situation. We have heard several calls for facilities to register. Now, I am of the opinion, and you can share with me your opinion by WhatsApp, 0244340437, or when I activate the phone line. I am of the opinion that we should not be uncertain about the status. Once somebody is doing the business we are interested in, we should know. So that's why I'm pushing this question. I'll bring it to you, Dr. Kluche. This transition period, it gives you time for that to manifest, okay? But it does not state that nobody should know. Now, if Pharmacy Council knows the status, is it that they are waiting till the 5th year to transfer? Is there a process underway that fully empowers you as the legally mandated agency to do what you're supposed to do?
Yeah, what I would say is that if you consider the Act 58 number 9, this Act established private hospitals and maternity homes board. Act 58 number 9.
Yeah.
And this act was repealed by Act 829/2011.
Amended in 69 and
yes,
then
exactly
repealed.
Yes.
Yeah. Well,
so we are given the new Act at 829/2011 that established HEFRA is giving the opportunity to all facilities that were covered by Act 58 number 9 to migrate to HEFRA.
Okay.
Right. And the Act 829/2011 gave these facilities 5 years.
2016.
Yes, 2016 to migrate totally to HEFRA.
Right.
What is our mandate? We are appealing to all these facilities to do so as early as possible. We go around to all these facilities, we visit them, we inform them to come to migrate to HEFRA. Some of them comply with this act, this directive, others have not. Those that do not comply to this directive, it means they are operating illegally. That's the point. Any facility that is existing under Act 58 number 9 that established private hospitals and maternity homes board, which was repealed, if you're working under that act, you know you're practicing illegally. So this is an opportunity once and for all to appeal to all these facilities to migrate immediately to HEFRA.
All right. You use the word immediately.
Yeah.
Okay, I'm quite particular when it comes to words. Okay, 5 years is 5 years.
Yes.
From 2011.
Well, can I correct this impression?
Yeah.
The 5 years was for pharmaceutical facilities.
I know.
The other facilities, which are the private facilities and the government facilities, were not given the 5 years.
I know.
Yeah.
Yes.
So they should.
So I'm
doing
sticking
that.
to the word
Yeah.
and the spirit
Yeah.
that establishes you,
Yes.
HEFRA.
Yes.
Right? So 5 years was 2016. And I heard the acting registrar suggesting that, well, they have 5 years. Has it lapsed or not for pharmaceutical facilities?
Yeah, exactly.
Yes. So you can be held in breach, right? Because this statement which suggests that, well, if I bring in the Pharmacy Council, right, is it still, I've forgotten his name now, I'll remember his name in a second, right? But if I bring them in, then they'll be able to tell me. The 5 years has lapsed, right? And we're suggesting and communicating to my listeners that HEFRA cannot give a definitive statement on the status of pharmaceutical practices and facilities in this country. Isn't that worrisome?
It's worrisome, though there's a lot of dialogue that took place between the two agencies. And we hope things will streamline, things will move on.
7 years of dialogue.
Yes, a lot of dialogue has gone on.
7 years of dialogue.
Well, I mean, the Pharmacy Council tells me that the 5 years were not actually, nothing happened for the 5 years under the previous administration.
How can they tell us that?
Well, that's what they said, that the 5 years really never started. Okay, I mean, when I came in March...
In law, both agencies are in breach of the law.
I would agree with you.
Both agencies, HEFRA and Pharmacy Council, and I say this with no equivocation, are in breach of the law. If the common person, maybe the small fry with a chemicals shop, is to be held accountable, I believe everybody should be. I've looked through the list of provisional licenses you have currently under Act 829 and the list of full licenses you have. I'm surprised and curious as to the absence of very, very, very big facilities on that list. I am reluctant to accept that they are automatically hiding under the 9 of the 1958 Act. I think as an agency, you should actually scrutinize that and bring them to order, which is what you sought to do in January when I heard you flex your muscles and your vocal cords. But now I'm getting a different sense of whether we want to do that. If we are in breach, and I know this discussion is not only about pharmaceutical practices, okay, but it sets the precedence, perhaps, for people to ask for leeway and make nonsense of deadlines and compliance. Head of operations, what do you say to that? How do we get people to really understand that this is law and it's not a matter of negotiation anymore?
I would not agree that HEFRA is giving them a leeway to operate. We did a lot of, he said that when purchasing first, the force must be applied. We are working on that seriously, and very soon the law will take its own course on those facilities that are practicing without license given by HEFRA.
Right.
And if they think they are hiding behind the scene, because the issue is the safety of the population of Ghana. It's not only about regulation, but it's purely about the safety of the standards of the population of Ghana. We have to make sure our population lives very well, access quality healthcare in this country.
Okay.
Right? That's our main issue. So definitely we are appealing to them once again to come to HEFRA to regularize their practice.
Okay. Great. Another appeal. 30 minutes past the hour of 2 on Joy 99.7 FM. I'm in the company of officials from the Health Facilities Regulatory Agency, HEFRA. They're based in Cantonments. Nice place, actually. And they regulate, they inspect, they register, license, and monitor health facilities across the length and breadth of this country. Okay? And I have the head of operations, Dr. Kluche, the acting registrar, Mr. Matthew Treme, with me. And I'm seeking to understand how they propose to go about this. I am uncomfortable with the idea that for 8-9 years, not much has happened. I agree and acknowledge that on their register currently, they have several facilities that have provisional licenses. And we were told last week that the registrar, after the due process has been done, can give a provisional license for 6 months. 6 months validity, right? So when I suggest or talk about facilities that have a provisional license, it's only valid from 6 months from the date that was issued. And then there's also a list of about, I guess, about 500 or more. 504 facilities. 544 facilities that have a full license, which means 3 years, and they've done their provisional of 6 months. And then it has been extended based on inspection and other things, right?
Yeah.
So 544 have full licenses, and how many have provisional?
61.
61. 544 plus 61.
605.
605 health facilities in Ghana are in good standing with HEFRA under Act 829 as we speak.
Yes.
Great.
Yes,
Now,
but then also should I also say that there are 82 who have also been issued a license, just that the processes are not complete yet with the signature of the board chairman for the license to be issued. So that is 82.
Right.
We also have 704 that are to be inspected very soon, ready for inspection, and we don't know what the outcome is going to be after the inspection. But we also have 121 that have already been inspected, and I'm awaiting for the report. I'm thinking that a big number of them would be successful because we're talking about basic minimum requirements.
Okay.
So if you add 121 to 704, you see that we're making good progress. We're making steady
You're counting
progress.
chickens that haven't hatched.
Well, I mean, it's good to have hope that chickens are going to be hatched. Yeah. So I mean, at least we know that they are following the law. They are doing what they are supposed to do.
You see.
But my worry is about those who are not doing anything about this.
Which you seem not to want to put a figure or a finger on.
Well, I can put a figure.
Right. Let me just help you, sir.
Yes.
Let me help you. We have less than 800 facilities registered, right? Licensed under your law, okay? Be it provisional or full license.
Yeah.
Okay? I have read presentations and publications and correspondence from HEFRA itself suggesting a figure of about 33,000, 34,000 health facilities. All right?
Can I just come in there?
And I'm coming.
With a figure.
I'm coming. These are things I've taken from HEFRA.
Yep.
And pronouncements even by your chair of board, current chair. Right? So even with those as conservative figures, that is a huge default. Now, when the acting registrar suggests that, well, there's a number that are being processed, I'm happy with that. But again, as a social scientist, I'll look at the full population, right, conservative, and that is alarming. I've also heard from you on this same program that there are challenges with resources and personnel. So if we speak to it properly and objectively, then maybe we'll see where we need to bridge the gap. Do you have the wherewithal, the resources, the personnel? Because last week I asked about zonal health committees. You don't have them. So the registration and all these processes are centralized in Accra as I speak. Right?
Most of it. Not
Most
all
of it.
Not all
Yes.
of it, yeah.
You see? And this may pose a challenge. So that's why I'm a bit worried about us being concrete about the figures and the facts.
Well, I mean, if I could help you with the figures.
Yeah.
As I said, the current regime came into being in 2017. So we know that the act was promulgated in 2011, starting in force in 2012. So between 2012 and 2017, I'll not be able to speak much to what had happened. But what I can speak to is the fact that from 2017 to date, a lot of good progress has been made. All right. So the numbers that we're talking of, the 33,000, is an estimate. Numbers that have been put over the place as possibly the number of health facilities that we have.
Are you suggesting there's no basis for the estimate?
I mean, there may be some basis, but there are no bases that I can speak to. I can speak to 16,064 health facilities.
So you disagree with your board chair?
Well, I wouldn't. I'm not saying I'm disagreeing. The board chair would have also said that they were estimated figures. I don't think he would have gone around to check the 33,000 to be in existence.
Do you not think, in fairness, sir, that the discrepancy between what you say you'd prefer to consider as the estimated figure, 16,000, and 33,000, the variance is too alarming?
Yes, but let me tell you, I was saying that, I mean, I have also said that there's an estimated number of facilities in the country, estimated to be about 33,000, to be about. Now, there are facilities that open and close. There are many of them that open and close.
If you went to Registrar General,
yes,
and you looked at health facilities registered under the Business Registration Act, would you be getting closer to some convergence of figures and an idea of the number of such facilities in Ghana?
Yes, maybe that is something that we could register, we can consider doing.
Wow.
But the thing is that sometimes when certain facilities register, I don't know how the Registrar General does it, whether they are sure that they are a health facility or not, and whether the Registrar General has a definition of what a health facility is.
Okay.
There are different facilities that go to register. Some of them are wholesalers. We don't deal with wholesalers. For example, for the pharmaceutical facilities that are wholesalers, we don't deal with them. Some of them are just research or whatever. I don't know. So I will not be able to speak to that. But what I'm saying is, let's go back to the 33,000, an estimated for a number. When I came in 2017, I was told that WHO said there are about 29,000. Right? So there are all sorts of numbers. What I set out to do was to be able to speak intelligently to these figures. Let's find out if we can.
You've deployed, you said last week, NABCO personnel.
Prior to NABCO, we deployed about 64 national service personnel last year.
Okay.
Yeah, NABCO is this year. So last year, and their main work was to go around the country to sensitize people about HEFRA, because I was told that many people didn't know what HEFRA was about, including health professionals. So that's number one that we do. Number two, they were also to ensure that we can have a number that we can believe because it's based on figures.
Okay.
Now, when that was done, that exercise was done at the end of the period, we were able to ratify or to speak to 16,064 health facilities.
Okay. All right. Odia Sampa Nana Ajimandria II says, I don't know and I don't think it's my responsibility as an ordinary citizen to go around checking who has been certified or not, or so. And ask a health facility that I visited to provide me his license before seeking health care. Your surveillance unit should be tasked to do this. After all, you're paid to do so. And stop always being in the air-conditioned offices. Well, thank you, Joy FM. Right, okay. This is coming from a listener.
Yes.
There's another one. Let me just quickly look for it. Akwesi Boachi says, there's no check and balance in Ghana. Most of our big health centers like Kolebu, Komfuanochi Teaching Hospital have poor facilities and equipment, poor washrooms. It seems at Kath they never renovated the old block washrooms. Okay, that's from Akwesi Boachi. Thanks for that. Abeku Bergson says, Joy FM is really doing well in sensitizing Ghanaians on this HEFRA agency. I've never heard of it, but I hope they deliver their mandate well. That's exactly what we're trying to help them do or partner with them to do. Maliki says, thanks NND, I guess that's me, naughty by nature or something, for bringing health issues to the populace. But one issue that bothers me is that many private clinics and hospitals don't have pharmacists, even though it's a requirement by law that Class A drugs are supposed to be dispensed by or under the supervision and expertise of a pharmacist. As most of these entities don't even have pharmacists, hence endangering the lives of their patients, what is HEFRA doing about this phenomenon? So you're getting it from my listeners. They are concerned, but they are becoming more and more aware of your agency and perhaps the efforts that you undertake, to get people, facilities registered. But still, they have questions. They don't think it's their business.
Yes, exactly so. But definitely we are doing a lot of work. If we talk of the big facilities like government facilities, Kolebu has started the process. Very soon we'll go a team, multidisciplinary team made of retired doctors, specialist consultants will soon visit Kolebu to do inspection. Reach Hospital has submitted the application.
When was the last time Kolebu was inspected? Head of operations.
Yes. So far Kolebu has not been inspected in
Ever.
terms of in terms of HEFRA's work. Yes. So Kolebu has gone through the process, is due for inspection, which is good news for us. Whole regional hospital has been
Does
inspected.
a facility, sorry, I'm
Yes.
jumpy because I'm getting scared. Does a facility have to give you permission to come and inspect?
No. Not really, no, not at all.
So what has prevented
Yes.
us from inspecting a facility under a law that came into being in 2011, right? A premier facility.
Yes, premier facility. We have our standard and program of inspection and the processes to go through. As I'm saying, talking now, Kolebu has gone through the initial process and is ready for inspection, which we are going to do very soon. Maybe possibly next week.
Kolebu has applied to HEFRA.
Yes, please.
When?
Not quite long ago.
When?
Not quite long ago.
It's still not a when.
Yes, it's gone through the process. Kolebu has gone through the process.
Okay.
And the good news is that the regional hospital whole has gone through the process.
Amen.
Very well. A team went there to do inspection. It's in the consideration for license. Reach Hospital has submitted application.
Obviously, who is easier to inspect than Kolebu?
Yes, of course, of course.
Can I come in with the Kolebu issue?
Yeah.
I mean, the thing is that for us to go and do an inspection, we need to start the process of making sure that we have the information that we require to be able to go in and do the inspection.
Okay.
You just don't get up and go and do inspection. Because if I don't know who the practitioner in charge is, if I don't know what service they provide, if I don't know the number of health professionals they have there, I cannot just go in there. But so for me to be able to go to do the inspection, I need to have all this information that I need to pre-check. Now, okay, so when I do check, that is when the registration begins. Now, the public service, public facilities have some kind of an understanding with, and we come back to what we were saying last week, with the National Health Insurance Authority, because their act says that they can't take somewhere as a provider if they don't have a HEFRA license. So therefore, the public facilities were given that kind of some leeway, so to speak, to be able to act. But now we said that period is over, and therefore all the facilities need to come. Okay. Now, the good thing is that they are taking their responsibility seriously. Korle Bu Teaching Hospital has started the process of giving us the data and the things that we need to check before we go in to do the inspection.
Okay.
And I would say we are in February. I think they started the process in early January. Okay, and hopefully by the middle of March, by the middle of this month, or the latest by the end of this month, we would have inspected Korle Bu and Kofu Anokye, the two big teaching hospitals in the country. Right,
great. 43 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. We are under scrutiny, okay? We are under the microscope and health facilities. If you run a health facility, if you head a health facility, I've got the SWAT team in the studio from HEFRA. And I'm breathing down their necks because I believe their function is so critical, essential. That is why I'm doing that. There's no malice or, should I say, negative antagonism at all. That's what I want to do. I'm going to activate the phone line, 0302-216-541. If you have questions, concerns, experiences, you can share them so that HEFRA gets a feel of our discerning listeners who represent Ghana in so many ways and so many regards, so that we get a sense of what is going on.
Can I say, since you're going to open the phone lines,
yes.
A friend of mine in New York who wanted to participate in this program last week said, you go too quick with the number. So could you just say it a bit slower so they can all pick it up? They said several times you travel, you couldn't pick the number up because you're too fast.
Okay, 0302-216-541. 0302-216-541. I'm sure if I had an American accent, they'll pick it. But we want your views. We're big on your views, and we get interactive this and every Sunday, 2:05. This is Ultimate Health, and we're really interested in this, and we want to partner with HEFRA. That's why we brought them back this week, not to bash them, but let's get it done.
Yes.
I am a bit concerned and alarmed that, Registrar, you seem to suggest that you now are getting information that is required about our premier hospital. And you seem also to suggest that that information is absent or was not given to you when you took over. Thankfully, your head of operations has predated you, right? Is it that you don't know the details of Korle Bu and they now have to submit everything anew?
I would not.
Sorry, I'm focusing on Korle Bu, but I want to use it as a litmus test.
Let's take it, Korle Bu and Kofu Anokye Teaching Hospital. These two big public hospitals. Before, at 8/9/2011, the regional health directorate in each region monitor and inspect those facilities. Right?
Okay.
Yes, on regular basis. Not only in Korle Bu or Kofu Anokye.
So if I wanted those records, I can get them?
Yes, you can get them.
Great. Okay, satisfied. Mafo in Achimota, good afternoon.
Good afternoon, sir.
Yeah, you're most welcome.
Thank you. I would like to contribute on the program.
You're most welcome. Share with us.
Okay. I work at a health facility, and I was sent on an assignment to register for HEFRA.
Okay.
I came to the office, and I was told to go to fire service and EPA for certificate.
Okay.
And my challenge is that I've not been able to come back to HEFRA because getting the certificate from fire service and EPA has been a problem.
Okay.
They are mentioning a huge sums of money for certificate, and I don't really know why we have to go through all this to come to HEFRA, whilst HEFRA is the main certificate that we need to register our facility. That's my point.
Right. Yes. So you're having some challenges.
Yes.
Okay, I'll put that to the head of operations. Thank you so much. Nanama is on my line from Korle Bu. Hello, Nanama.
Good afternoon, Ate.
You're most welcome.
Okay. I thought HEFRA was for private health facilities. I want to be clear on that because I'm hearing Korle Bu, RAGE, and all that.
Do you have a facility yourself?
Yes, I have a facility, and I'm registered with HEFRA.
Great. Okay, so you want to see or understand this transition between the private hospitals?
For the private.
Yeah. Okay. All right. Thanks. That's Nanama.
Okay.
I have Sam on my line. Hello, Sam.
Yeah. Good afternoon.
Good afternoon, Sam. Where are you calling from?
I'm calling from Accra.
Accra. Share with us quickly.
Yeah, I'm quite interested in what you're discussing now because, and I'm happy you are mentioning Korle Bu. Because if you attempt to go to Korle Bu and want to visit any of the washrooms, my goodness, you'll be reluctant to use any of the washrooms. And I'm not surprised about the hospital infections that they report. I'm not surprised about cross-infection. I'm not surprised about so many other things.
Okay.
And unfortunately, this is a premier hospital. The earlier they do the inspection, the better. People are dying simply because of infection. And this is not good for us as a country. And for so much like Korle Bu, so something has to be done.
Okay. Great. Thanks for sharing. Lukman is on my line. Good afternoon, Lukman. Oops, I've lost Lukman. 0302216541. So a sample of these. Somebody wants clarity on this public-private divide.
Yeah.
And then the challenge with fire service, EPA, etc.
Yeah. Can I, before the head of operation comes in, can I just say that the act we're talking about is Act 829. Okay, and Act 829, in the first part, talks about the works that we do as regulators of health facilities in the country. Now, the Act affects all health facilities, both public and private, or quasi-public. So let's agree that it's all, in the case of the gentleman who asked about whether public, Nanama, the lady who asked, just to be clear to her that it's all health facilities. Anything that you consider a health facility, for example, where you go to talk to a doctor about whatever problem you may have with your health, it's a health facility. Where you go to get something checked for you in a lab or a diagnosis center, is a health facility. Wherever you go to take a medication, buy medicine, is a health facility. So that is that. And it's everything, both public and private.
Okay.
Now, with respect to
fire service, EPA.
Checking on that. Now, if that gentleman's, is this Sam?
Sam.
No.
Yeah, Sam.
No, Sam was talking about the infections and things like that. But the other person was talking about the requirements. Okay. If they are very interested, they could go to Section 12 of the Act.
Okay.
The Section 12 says that a person shall apply to the agency with for a license, and they shall be attached to the application. So when you are applying, we are not just telling us you want to open a health facility. You have to attach certain documentation to your application. Okay. And it talks about the block plan, it talks about the approval from the district the Metropolitan Assembly, it talks about clearance from the Environmental Protection Agency, it talks about plans of disposal of medical waste. So it talks about all sorts of
all
things.
These are your responsibility.
We need to check them.
As the applicant?
Yes, as an applicant, yes.
Okay.
Because if you set up a, a health facility, we want to believe that you are fire compliant.
Okay.
So that people don't come in there and get burned down, or you are environmentally safe, that people don't come there.
Point taken. I have Ajiman on the line from Tema. Ajiman.
Yes, sir.
Yes. You called last week, didn't you?
Yes, sir.
About somebody running a maternity home and doing abortions.
Yeah.
Okay. Right. Committee 4. They needed information from you, so make sure you give your number to Abeku.
Okay. I have his number.
You have his number. Great. Okay.
Yeah.
So share with us quickly.
Yeah, I want to ask a quick question. The registration that they are doing, I want to know the criteria at which they register people, because in Ghana here we believe in documentation, but do you also check how well would the person work on the field before they register the person?
Okay. So you're talking about practice, all right? Standards of practice as well, all right? Ajiman called last week, so he will facilitate that bridging so that we can get the information about the maternity home and the abortions and stuff. Right. Yeah. He's asking about standard of practice. Is that the Medical and Dental Council, or do you have a portion of that?
Yes, exactly. One of the documents to submit is the documents of the practitioner in charge. That's the certificate of the practitioner in charge. He or she has to be minimum of 5 years post-qualification experience.
Yeah, we learned that last week.
And be of good standing with the professional body to which he or she belongs to.
Okay.
So those are the major things. Definitely, if you have that, we also cross-check. Cross-check from the Medical and Dental Council. We check from the professional bodies whether that person is of good standing.
Okay.
Yeah.
All right.
Before we go ahead to.
Great. I have Lukman back on the line. Lukman, good afternoon.
Hello, good afternoon, Mr. Noti, and good afternoon to your resource person.
Right. Go ahead.
Yeah, please, I would like to know how many pharmacies can be at one location. Is there any limit when it comes to one location? How many pharmacies can be there?
So you're asking, should they be spaced according to some regulation? Or can you have a chain of pharmacies in the same location?
Yes, That's it. That's my question.
Okay, right.
Yeah. I mean, as we go back to the same thing, the Pharmacy Council. Pharmacy Council has got some rules of where you can establish a pharmacy.
Okay.
I think they talk about 400 meters from each other. And then with over-the-counter medicines at the shop, there are also some requirements that you need to follow. That is, the place should be a place which is in need of that service.
Okay.
And that is, I think, 1 kilometer, 100 meters from that. So there are certain regulations. You cannot just set it up anywhere. Now, in other places, we call something saturation. Saturation is when you have too many of one thing in a place, and therefore you try to. But what they've done that to ensure, because Pharmacy Council, from their law, mandates them to make sure there's equitable distribution of pharmaceutical facilities. Therefore, they need to have some kind of distances so that we can ensure there's equitable distribution of pharmaceutical.
Let me ask this question, Head of Operations. You know, I've looked at the documents or the register we have now of provisional and full licenses, okay? All of which are in recent issue, okay? Is it to suggest that prior to 2018, 2016, no licenses were issued? I looked at the dates because you've got columns for the date of issue, date of expiration. I don't see anybody whose license was issued, for example, in 2015 and is still waiting for 3 years, right?
As the registrar said, when he took over in March 2017, we started from that period. The license, the provisional and the long-term license we gave were from that period. But generally, before 2017, under the old administration, they were issuing some licenses, and they were calling them temporary licenses. And those days, the board
that is alien to the law.
Yes, the board was not in place.
Wasn't there a board?
Yes, there was no board those days to issue long-term license. So the license that the previous administration was given, they call it temporary license.
There was no board before this board?
Yeah, they call it temporary license.
No, but there was no board before this board.
Yes.
Well, can I explain that quickly? I mean, there was a board, but the board was not really functional with respect to issuing long-term licenses. I'm sure you would have heard or read from the news in 2017 thereabout when the board was dissolved. There were issues. Yeah. So I mean, the registrar can only give provisional license which lasts for 6 months. So therefore, if there's no board to convert the provisional license to a long-term license, there's no way you're going to have any long-term license.
So that 6 months would lapse.
It will lapse.
And what happens when the facility wants it's renewed?
During those days, when the 6 months expired, unfortunately, they gave them extension, which they were not supposed to do. But because they didn't have a board and the facility needed to have a license for whatever reason, the board was not in place to turn those long provision into long term. They had to give them some extension. So I inherited 466 provisional licenses from the previous administration.
Okay.
These have now been converted, and I want to believe most of them have now been converted into long-term licenses. Now, so that's in answer to your question. In answer to your question, why are there of them recent dates? That's the reason. Now we have a board in place, and the board was enacted or was launched September 21st, 2017.
Right.
So from 2017 onwards, the board is able to issue long-term licenses. We started with 1 year licenses, which expired, and then we had to do long-term licenses of 3 years, which are now what we're talking about. Okay.
Right. So, I have the head of licensing here who wants to. The process. Okay. You want to talk about the process of registry? We only have 3 minutes left. Okay, just quickly.
Okay, Note, thank you very much, and thank you so much for having us in the studio. I actually wouldn't want the HEFA team to leave here without us talking about the process of getting a license with HEFA. So I'll just go through it briefly. Like my bosses have said, the process starts with registration. And with the registration, you first have to pick up an application. You can download it online and you fill it. Based on what you want, we have the specific requirements and then the general requirements. So if you are suppose you are setting up a diagnostic center, the requirement is not the same as if you are setting up a hospital.
Obviously, okay.
So when you go to the website, you go to downloads, you can download the application from there, and then you get the specific requirements and then the general requirements. After that, you submit the application form with your processing fee.
Okay.
And when all the documentation is done, that is after the registration team has vetted the document and seen that everything is in place,
right,
or you've met the minimum requirement in terms of registration, it is moved to the inspection stage. The inspection is made up of a team of professionals, depending on the kind of facility that is going to be inspected. Exactly.
Right.
So depending on the team of the kind of facility, if it's a diagnostic center, we know who is going to head that team.
Okay.
If it's a clinic, we know who is going to head that team. If it's a dental clinic, we know, then it means obviously a dentist is going to head that team. So it's a team of professionals who actually go for that inspection. And then the inspection is divided into 3 parts. We have the medical part, the safety and management, and then we have the laboratory part. So it's always a team of 3 that goes for that inspection. After they have gone for the inspection and brought back their report, the inspection report is reviewed by another team, not by the same team, but another team.
Right.
So after the inspection report is reviewed by a team, that team recommends the facility for a license based on the inspection report review. So they can
should it be positive?
Should it be positive?
Right.
Exactly. So based on the report, it is recommended for a license, and that is when a license is issued. So all things being equal, the process is not so cumbersome. It's not very difficult.
Is there a required or stated specified duration for all these things to take place?
It all depends on you, but then I also think that once you get everything in place within the period of 3 months, everything, that's even the maximum.
Okay.
But for HEFRA, even if you get all your documentations in place within a week, we can get your license ready for you. So it's not very difficult. So we're encouraging all facilities to come and register and be in good standing with the law.
Okay.
Thank you.
All right. With provisional licenses, it's supposed to be 30 days.
30 days. Okay, great. We're learning and we're growing along with HEFRA, and I'm hoping some of these are available on some kind of client-centered kind of IEC materials. You can get a flyer that gives you these steps to facilitate. And I'm hoping also that there's some form of client service outfit when people come, so that the frustration can be managed and people can be helped to partner HEFRA. Once again, I thank you, Registrar and Head of Operations and Head of Licensing, for gracing our studios. There are bigger issues ahead, and we're hoping that we can monitor and regulate what you're doing so that we get the desired outcome for our nation. Once again, thank you. Many thanks to you, my listeners, and thanks to Abe Kusa Kofi. We'll put you in touch with Ajiman in Tema. Next is Ignatius Ejabin Iggy with Sunday Rhythms. They can stay on Joy 99.7 FM.